Dr. Jeff Hart from Highland Family Medicine is back with us this morning. Doctor, good morning.
Good morning.
So last week we reported about an increased risk of blood clots in patients, especially younger patients with COVID-19. What is happening here? What do we think is happening?
Well, you're right. There was a study published showing that clotting events are much more common than expected in patients with COVID-19. Most of these clots are blood clots that go to the lungs. People have heard of pulmonary emboli, so blood clots that form somewhere in the body and then move to the lungs. There's also been an increased incidence or frequency of strokes, especially in younger people. So there's something going on that's making people with COVID more susceptible to blood clots than we might expect from a disease like that.
Yeah, frightening study. The question is, why do we think this is happening?
Well, people have been following this, probably have heard this expression called cytokine storm. But there's something that happens to some people, not all people who are infected, where their body all of a sudden becomes very inflamed. This is generally not right as the illness starts. It's after a while. In the hospital, we've seen it up to a week afterwards, where people have this large amount of inflammation. And part of that is making the blood more likely to clot and making them susceptible to these problems, which are added on to the problems of the infection.
So as we learn this and we're aware of it, what can be done to help these patients?
Well, everyone who's admitted to the hospital, and this has been true for years, is put on anticoagulants unless there's a reason not to do that. So if they're at a high risk of bleeding or they're about to have surgery, they wouldn't be put on anticoagulants. But otherwise, everyone is put on medicine to help prevent blood clots. The question for COVID patients is, would it be worthwhile intensifying that? Would it be important to put them on extra coverage to prevent blood clots? And we don't know that yet. There are lots of investigations going on to look into that. We have to wait for more information. So right now we're giving people standard anticoagulation until we have more information about what to do.
To me, when I look at this and I hear about this information, it really underscores the importance of clinicians to talk about what they're seeing with their patients, not just here locally, but across the country.
That's exactly right. People might be becoming frustrated because it seems like it's a moving target. We keep on changing what we're saying, but that's because we're learning more things. And at the hospital I work at, we meet regularly to talk about what each of us are seeing so we can share our experience, and that's true nationally too, and globally. A lot of the information that we have is coming out of China, the initial studies that they did on when the disease first appeared, but the whole world is really sharing this information and trying to figure out what is the best way to take care of these people now.
And we appreciate all you're doing, Dr. Harp. As always, thank you. We'll leave it there this morning. We appreciate your time.